For example, in 1990, a lot of the premature mortality could be ascribed to neonatal conditions, maternal conditions, and infectious diseases like measles and tuberculosis, lower respiratory tract infections, and diarrheal diseases. But now in 2019, we are seeing non-communicable diseases actually taking up a good majority of premature mortality and disability in Pakistan. And these include ischemic heart disease and stroke. So people don't take a lot of fresh fruit. They have diets that are high in fat, carbohydrates. They consume tobacco. They both inhale it and chew tobacco as well. That's a risk that contributes both to cardiovascular disease and the rise in cancers that we see. Additionally, we've got air pollution that's gone up dramatically in the last few decades, and that is again a contributor to mortality through development and genesis of cardiovascular disease. I think given the climate change, water crises that we foresee going forward, climate change related food insecurity that might be coming up in the next few years, we need to have clearly a proper nutrition policy and implementation of that nutrition policy across the country, specifically targeting areas that we know have significant inequity, and principally working on maternal and child nutrition. There was displacement of people, the disease that came because of displacement, the diseases related to the water that was kind of standing, stagnant, diarrheal diseases. We had vector-borne diseases that went up drastically around the flood-affected areas like malaria and dengue. But what else happened at the time? The floods took up area where we had infrastructure for health access. It will be in our best interest to implement proper preventive programs and get them started early. If that group, we miss that boat, then we have that whole population sitting under the age of 40, which is now exposed to all the NCD risks, entering into higher age groups with NCDs. And the infrastructure for NCD management across the country is just not there.